Hi, I'm Jackie Davis with Delta County Memorial Hospital, and June is Men's Health Month, and we want to remind you that prevention is priority. So to all the men in our lives, listen up. We want you to take just a few moments and listen to some of our amazing doctors here at Delta Hospital and learn a little bit more about men's health.
Yes, we are in rural Colorado. We're close to the sun. Men's health. There is a lot of farming in the area. So looking out for growths and bumps in the skin is important. Of course, the big one is melanoma. That's a bad cancer that we want to look out for, identify early. But there is other cancers that, although they carry that dreaded word cancer, they're not as bad. Squamous cell, basal cell. Those are important to identify early also, but you can remove them and it's gone. They don't pose a problem anymore.
Well, prostate cancer is certainly the most common. The prostate cancer patients that we see are usually, and most of the time, seen by urologists, first of all, and then they're referred to us at later stages in their disease and treatment. Of course, lung cancer is very common in men. Probably colon cancer is also high on the list. But the three most common, I would say, are prostate cancer, lung cancer, and colon cancer. But one of the other areas that we take care of are people with hematologic malignancies. And what I'm talking about there are diseases like leukemia, lymphoma, and certain blood diseases where the bone marrow isn't working right, so to speak. And that's a fairly significant portion of our practice and not something that people appreciate as far as cancer per se, but these are all cancers of the bone marrow, so to speak, and are as important as the types of cancers that we talked about with colon cancer, breast cancer, lung cancer, prostate cancer. And so the blood tests that are done when one does the health fair screening also include a complete blood count, which is a first step in recognizing perhaps some problem with the bone marrow or a hematologic malignancy. With regards to diseases like Hodgkin's disease and lymphoma, of course, lymph nodes that are enlarged are usually one of the first things that we see there. But I think it's important to understand that the hematologic malignancies are a very important part of what we do and also things that people need to be aware of.